Hi and welcome. I'm trying to learn medicine today, Callus, and after we've done it, we're gonna do standing yoga. And if you participate in the standing yoga, then it's very honest. And we're talking about illness, disease, medical thing, and about anatomy and things. And this is no medical advice, we're just learning about it. Callus. That is when an abnormal pressure or friction is continually exerted on an area of skin. The skin thickens to form a callus or callosity. I still don't know what a callus or callosity is, but it is wrong. The most common site is the sole of a foot, beneath a prominent bone. In nearly all cases, there is an existing disorder of the foot. For example, the toes do not take the proper share of the weight borne by the foot, or the foot is turned inwards when walking. Okay, let's use it again where we know it happens most of the side at the other side of the foot. Callus is when abnormal pressure or friction is continually exerted on an area of skin. The skin thickens to form a callus or callosity. The most common site is the sole of the foot beneath a prominent bone. In nearly all cases, there is an existing disorder of the foot. For example, the toes do not take the proper share of the weight borne by the foot, or the foot is turned inwards when walking. Sometimes the skin of the affected area becomes hard, thick, slightly raised, and insensitive. Duration. The callus remains for so long as the pressure continues to be exerted. Causes. Pressure from badly fitting shoes. This is the second time we have something with shoes. We had previously bunion. Bunion, that was swelling of a joint of a big toe because the shoes are too small. Treatment in the home. Well-fitting shoes. Padding in a shoe may help to reduce pressure and pain. I don't know what padding is. I think I know it. But I don't know this way. When to consult with doctor. If a callus are caused considerably discomfort, what the doctor might do? Refer the patient for possible treatment of any underlying disorder of the foot. Yes, because we said in most of the cases there is another disorder with the foot. For example, that the toes are not taking the proper share of weight borne on the foot, or the foot is turned inward when walking. Prevention. Well-fitting shoes, especially when young, because they said that by the bunion, when people are young, the feet or the toes are easier to be deformed. Outlook. Callus almost always clear up when properly fitting shoes are worn. That was Callus. If you were here for medicine, then you can go directly to the next part of medicine. We will do now the standing yoga. If you stay and participate in the standing yoga, then it's with your own risk. The feet are standing together and we're doing the ear swings. Breathe in, lift the arms up. And breathe out, lift the arms down. Again, in the arms up. Again, in the arms up. And out, open to one side, the body soft. Again, in the arms up. And out, open to one side. Again, in. And out and down. Now breathe in the cup in the morning. And breathe out, draw the shoulder blades together and open chest to the sky. Again, in the arms up. And out and again down, draw the shoulder blades together. Again, in the arms up. Hands together, breathe in. And out, lean back, the read in the morning. The read in the wind. In the arms up. And out, lean back. Again, in the middle. And out and back over to one side. Again in. And out over to one side. In. And out and down with the arms. Now make an inner space between the feet. Breathe in, lift the arms up. We're doing the heighted seek playing palm tree. Breathe out, open the arms to one side. Breathe in into the middle. And breathe out and sink down. And and out on the arms to the other side. Again in, and out and down. Again in and up. Out and down, we're leaning onto our knees. We're doing standing cat and cow. Breathe again in. And out, we're making a little back for cat. Again in. Out. And in the back for cow. Again. And out for cat. Again in. And out for cow. One last round again in. Out. Again in. Out. And out, come slowly with the rope back up, back to the top of the shoulder. Next exercise. Let's do the scuttle. Breathe in, lift the arms up, feet together. Out, close the arms, intertwine the fingers, reach high. Breathe out, reach to the front, out of the backward trail. And again in. Out, close the arms differently. Breathe in, reach high. Breathe out, reach in front, out of the back. Again in. And out and down. Now again an inch space between the feet. Breathe in, lift the arms up. And breathe out and open to one side. Breathe in the arms up. And breathe out, we go down into the chair. Breathe in, come out here. Come on out. And breathe again in, come up. And out, arms to the side. And in, up. And out and sink down into the chair. Breathe again in, come halfway up. Come on out. And breathe out and come up. Now bring the arms down, but don't dive into them. Feet together, and we hang down. Now we do the movement. Breathe in and lift the right leg. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. Again, in and change. And out and stretch the left leg. Again, in and change. And out and stretch the right leg. In and change. Stretch the left leg. In and change. Out and stretch the right leg. Again, in and just down. Another penguin. Breathe in and lift the right hand up to the sky. Breathe out with the left knee. Look over the right shoulder to the right hand. Again, in and the arm down. And breathe out and just down. And now breathe in. Lift the left hand up to the sky. Breathe out with the right. And look off the left shoulder to the left hand. Breathe in, hand again down. And out and down. And now we're doing the pelican. Make half the space between the feet. Shift the weight to the heels. And breathe in and come down. And breathe out and come in. In and down. And out and up. And again. And out and up. And one last time, in and down. And out and up. Another trigger says counter back. Take hold on the elbows and gently rock from side to side. And hands again down, feet together. You can come halfway up to monkey half lift with a straight back. Breathe out and down. Again in, halfway up, straight back. Out and down. And now breathe in the up, the next one. Bring the arms up and bring the hands slowly down. Now the hands together and also the elbows. And now lift the arms slowly up. As high as it goes with a little bit of it. And release again. And again, the arms up. And down. Now the cashew, intertwine the fingers behind the back, have the feet joining. Fist together. Breathe in, straight back, shoulders back. Breathe out, head over to one side, shoulder down to the clavicle. Breathe again in. And out and pull the hands down to the ground. Again in, lift the gaze. Turn the head out to the other side, shoulders back, breathe in. And out, chin down to the clavicle. Pull the hands down to the ground. Again, lift the gaze. back into it. And now we stretch the Venus. Reach out of the folded part, and throw the fingers behind the back, bring them out to one side, breathe in, strong up, tall up, and out, head out to one side, and chin down to the clavicle, breathe again in, and out, pull the arm and the shoulder down. Again in there, lift the gaze, head up over to the other side, push the hands over to the other side, tall up, chin down to the clavicle, breathe again in, and out, pull the arm and the shoulder down. Again, lift the head back and on the side. Good and sit standing. One arm behind the back. Tall up, bring the arm over to the head and carefully, only a little bit over to one side, just a little bit. No pulling, just a little bit. You can turn the head also a little bit up to the side where the arm is up. And again down back into it. And we're changing the arms, one arm behind the back, tall up, with the arm up, take the head, and just go over to the side, no pulling. And we can turn the gaze also up to the side where the hand is at there. And again, it's middle and arm down. And let's do the sky yoga, breathe in the arms up, without long arms open. Again, in into the middle. Out back. The arms together, breathe in, come up onto tiptoes. Again, in space between the feet and out and sink down into the chair. Breathe in and come up again. And breathe out and go again down. Let's do it one more time. Come up. And in and out, bring the hands down, feet together, head bit on the eagle swings, breathe in, lift the arms up. Without the arms down, in the arms up. And out the arms down. And last movement, the cactus collecting its things in the evening, breathe in the arms up. Bring the hands to touch and lower the hands down to heart center. That was the Yoga. I thank you very much and until next time.